18. Which of the following choices most accurately describes the role of serotonin in OCD? A. Serotonergic drugs are an ineffective treatment. B. Dysregulation of serotonin is involved in the symptom formation. C. Measures of platelet binding sites of titrated imipramine are abnormally low. D. Measures of serotonin metabolites in cerebrospinal fluid are abnormally high. E. None of the above 19. Therapy for phobias may include all of the following except A. Propranolol, Inderal. B. Systematic desensitization. C. Phenelzine, Nardil. D. Flooding. E. Counterphobic attitudes. 20 first-line medication treatments of anxiety disorders may generally include all of the following except A. Fluoxetine, Prozac. B. Fluvoxamine, Luvox. C. Venlafaxine, Effexor. D. Diazepam, Valium. E. Nefazodone, Serzone. 21. Induction of panic attacks in patients with panic disorder can occur with A. Yohimbine, B. Carbon dioxide, C. Doxapram, D. Cholecystokinin, E. All of the above directions. Each set of lettered headings below is followed by a list of numbered words or phrases. For each numbered word or phrase, select A. If the item is associated with A, only B. If the item is associated with B, only C. If the item is associated with both A and B, D. If the item is associated with neither A nor B. Questions 22 to 25, 22. Higher rates for women than for men, 23. Lifetime prevalence of 3 to 5.6%, 24. Lifetime prevalence of 0.6 to 6%, 25. Relatives have higher rates of this disorder than relatives of controls. A. Panic disorder. B. Agoraphobia. Questions 26 to 30. 26. Response rates between 60 and 80% have been reported to buspirone 27. Patients with the disorder may still be responsive to buspirone after being exposed to benzodiazepine 28. Buspirone's use is limited to potentiating the effects of other antidepressants and counteracting the adverse sexual effects of selective serotonin reuptake inhibitors, SSRIs, 29. Relapse rates are generally high after discontinuation of medication. 30 tricyclic drugs have been reported to worsen anxiety symptoms in patients where first symptoms were precipitated by cocaine use. A. Generalized anxiety disorder. B. Panic disorder. Questions 31 to 34. 31. Produces 80 to 90% panic-free status in panic disorder within at least 6 months of treatment. 32. May be nearly twice as effective in the treatment of social phobia as a more educational supportive approach. 33. Goals are more ambitious and require more time to achieve. 34. Combining treatment with medication may be superior to either treatment alone. A. Cognitive behavioral therapy. B. Psychodynamic therapy. Directions. Each set of lettered headings below is followed by a list of numbered words or statements. For each numbered word or statement, select the one lettered heading most closely associated with it. Each lettered heading may be selected once, more than once, or not at all. Questions 35 to 39. 35. Fear of dirt and germs. 36. Fear of heights. 37. Fear of strangers. 38. Fear of dogs. 39. Fear of cats. A. Acrophobia. B. Cynophobia. C. Mysophobia. D. Xenophobia. E. Ailurophobia. Questions 40 to 42. 40. The cell bodies of the neurotransmitters neurons are confined primarily to the locus ceruleus. 41. Benzodiazepines enhance the neurotransmitter's effects at its receptors. 42. The cell bodies of the neurotransmitters neurons are localized primarily within the raphe nuclei. A. Norepinephrine. B. Serotonin. C. Beta Aminobutyric acid, GABA. Questions 43 to 46, 43. A patient is presented with photographs of snakes while practicing various relaxation techniques to overcome fear. Gradually, he practices relaxation while in the presence of live snakes. 44. A patient with OCD attempts to use public telephones and doorknobs while intentionally refraining from washing her hands afterwards. 45. A patient is asked to imagine his wartime experiences as vividly as possible in order to confront his memory of the traumatic events. 46. A patient breathed through a thin straw in order to produce the sensation of not getting enough air. This activity produces a similar sensation to the distressing feeling of getting on an airplane. A. In vivo exposure. B. Interoceptive exposure. C. Systematic desensitization. D. Imaginal exposure.